My name is Dr. Tanya Ghosh, and I'm a retinal specialist practicing here in the heart of the Silicon Valley for approaching 25 years. My co-authors and I will be presenting an absolutely novel, non-invasive intervention for central serous chorioretinopathy, or as I will call it in this presentation, CSR. The intervention is breathwork, meaning using certain prescribed breathing exercises to resolve CSR. I will start by giving a very quick and albeit superficial review of CSR and how we came to using breathwork for its treatment. I will discuss the technique and the study that followed. We ophthalmologists are all readily familiar with classic CSR, where a patient, often a male, presents with central blurred or distorted vision, usually in one eye. Clinically, we see a blister of fluid in the macular area, and the OCT often shows the serous fluid as such. I've seen many cases of it here in my Silicon Valley practice. Silicon Valley is anecdotally known as the place where geniuses come to feel mediocre. There are a lot of brilliant, driven, successful people here, daily fueling world-changing innovations. However, this level of productivity comes at a human cost, which is stress. We all acknowledge in our field that stress can be the main causative agent of CSR, along with some medications, of course, such as steroids, etc. We directly address any causative drugs, but the treatment of CSR doesn't really have a fixed algorithm outside of that. But often enough, after interviewing the patient, we find that the person is under a high level of stress that may have had an uptick when the blurred vision began. We counsel the patient to work on the stress to see if that will resolve the CSR in the following months. If the patient returns without resolution, we then can use some modalities such as micropulse laser, drugs such as spironolactone, eplerenone, anti-VEGF injections, perhaps reserving photodynamic therapy with verteporfin, PDT, as the final treatment. This process can extend over many months. In my own practice, I was receiving patients in consultation with the more recalcitrant or resistant CSR, in whom these other modalities had already been implemented without full success, as I had access to the photodynamic therapy laser and years of practice in using it. Well, I had been reading books and articles, listening to podcasts on using breathwork for the reduction of stress and the improvement of sleep quality, as calming breathwork activates the parasympathetic nervous system. After a few pleasantly surprising successes of full resolution of CSR, the idea of a study was born. 15 people with CSR, which were confirmed clinically by OCT and fluorescein angiography, had been referred to me by my retinal colleagues here in our Silicon Valley practice. Each patient had one or more of the previous mentioned treatment methods, but didn't have full resolution of the CSR on OCT. When I saw them, I gave each patient a very comprehensive discussion on CSR pathophysiology and then offered photodynamic therapy with verteporfin or given the option to try breathwork to aim for resolution. I discussed that there was a possibility that the breathwork wouldn't be effective and that would extend the time before proceeding to PDT by perhaps a few additional months. All 15 wished to start with the breathwork. I demonstrated the breathwork technique to the patient and gave them a written sheet with the technique written on it. I asked the patient to do the series, which takes about 5 or 6 minutes at least twice a day, in the morning and in the evening. I encouraged the patient in saying that this is a case where doing more repetitions is better, and if they are unable to do the whole series, to do any one of the series that seemed easy and comfortable. No adverse side effects were expected. I'll give you the results before I demonstrate the breathwork techniques. Of the 15, 12 resolved fully on OCT when they were seen back at the 6-week mark. 2 had some partial resolution or improvement on OCT and wished to continue the trial of breathwork. Both fully resolved at the next 6-week interval. There was one patient in whom breathwork didn't work. He acknowledged that his stress was so high that he wasn't able to follow the exercises. He then opted to go on to PDT. I'm awaiting the results of the second PDT session on him, as the first didn't cause any resolution at all either. No adverse side effects were reported. In summary, 14 out of the 15 patients who had tried other methods prior and didn't have full resolution of CSR resolved after the breathwork. Allow me to demonstrate the 3 techniques which I distilled down to be undaunting to the patient as far as technique and time, and can easily and seamlessly be taught by the clinician, even with a face mask on. The first is the following: 2 snorts or quick inhalations up the nose and then out the mouth. A long exhalation is encouraged. So in and out. In and out. In and out. In and out. If you can do more power to you. The next is 4-7-8, where you breathe in through the nose to the count of 4. Hold for the count of 7 and exhale through the mouth, either actively or passively, to the count of 8. So again, allow the demonstration. Nasal inhalation, 1, 2, 3, 4. Hold, 2, 3, 4, 5, 6, 7. Breathe out, 2, 3, 4, 5, 6, 7, 8, and hold. Inhalation, 2, 3, 4. Hold, 2, 3, 4, 5, 6, 7. Release and exhale through the mouth, 3, 4, 5, 6, 7, 8, and hold. I, of course, just demonstrated here 2, and I recommend 4 be done, if not more. The last technique is to take your right hand out in front of you, then come back and plug the right nostril externally with the thumb, and to breathe in and out at least 8 cycles of breath, if not more, just through the left nostril. In yogic breathing, the left nostril is for relaxation and the right nostril is for elevation energy. So we want in this case to close off some of that anxious energy, so we close the right nostril. None of these techniques have to happen in some contorted yogic position. It can be done in front of a TV. Any one of the techniques can be done in isolation. The effects of relaxation happen about 10 minutes later as the hormones in the body shift. The pulse usually goes down, as does the blood pressure. I do encourage that it be done before bed, as many commented that it helped them fall asleep and stay asleep. Although the study was done on difficult cases of CSR, the ones that were unresolved after other treatments, I firmly believe this technique can change and reshape the paradigm and how we treat CSR by directly treating its source. Instead of patting the patient on the back and telling them to reduce their stress, we now have a defined, deliberate, and easily accessible protocol to help stress reduction and thus CSR. Thank you.